it's true or not. I just...
All right, welcome back to the program. We're having, interesting private conversation, which of course will make public very soon. We're talking about the crucial efforts to safeguard the health and well-being of millions of Nigerian children, actually, which is taking center stage through an integrated campaign targeting measles, rubella, polio, human papillomavirus, and other such big names, of course, through vaccine preventable diseases, including neglected tropical ones.
Yeah, absolutely, Claire. It is a comprehensive initiative designed to strengthen routine immunization, reach the most vulnerable populations, and move Nigeria closer to a healthier, safer future for all.
So at this hour, we will be exploring why this campaign matters, challenges that come with such a massive public health effort, but most importantly, we'll be looking at the impact it could have on our children and, of course, communities across the country.
So to help us understand the scope and significance of this drive, we are now being joined by Dr. Muyi Aino. He's the Executive Director and Chief Executive Officer of the National Primary Healthcare Development Agency. Dr. Aina, it's good to have you again join us. Good morning.
Thank you and good morning.
Good morning. Good to have you. Let me start first of all, so that we can catch up with a lot of clarifications within the given time. Talk to us about this campaign. What really makes it integrated, and why is it very significant, given the impetus you have given to it at this time?
I think just to first of all remind all of us that one of the top priorities of President Tinubu's government for the health sector is to reduce preventable deaths among children. Vaccine preventable diseases account for a large majority of this. So vaccines are very important to safeguarding the health and well-being of the Nigerian child. Now, when you look within that, there are certain diseases that are very common, that are very often and have, caused a substantial number of deaths. This year, across the country, we have recorded over 10,000 cases of measles, for example. And, the deaths that are on record are at least 76 of them. That's 76 children too many that have lost their lives unnecessarily. And this is because over the last several decades, there have been efforts to improve the coverage, the reach of children with routine vaccines, but there have been gaps that we are now trying to catch up on. So the president graciously approved that we do this integrated campaign that does a number of things, using one platform to reach over 106 million Nigerian children between birth and 14 years old. And the idea being that there are many interventions that they need, that the same health system is trying to give to them. If we're going to be going out to look for them, why don't we try to reach them with as much of it as possible at the same time? It saves money, it saves time, it's more efficient, but it also serves the needs of the child some more. Yeah.
Okay, while telling us about the effectiveness of this integrated campaign, can you talk more about this so-called, is it rubella?
Rubella. I know you're going to ask.
Because, she said it's more deadlier than the measles and all that. Can you just...
So rubella, interestingly, is also a childhood rash. That's how it presents, that occurs in children. Clinically, it tends to be a bit milder than measles. In fact, most of the time it's confused for mild measles, but it's not measles. The most important attribute of rubella is that, when pregnant women get it, it can have very devastating impact on the unborn child. Children are born with life-damaging deformities, blindness, deafness, brain abnormalities, heart abnormalities, and things like that, what is called congenital rubella syndrome. And that changes the lives of the parents, changes the lives of the child, and denies that, family the ability to live a fulfilled life. So that is very, very important. That is why we're trying to reach everybody, even children, but also people that are going into that adolescent age that will start to have pregnancies. Now, the good thing is we have a product that works. That's the good news, and we have an opportunity. The government is administering it to all the children, and we encourage all Nigerians to tap into it.
Let me just do a follow-up, so people will understand, the gravity of rubella in pregnancy, because we've seen in recent times, a lot of pregnant women who, give birth to, babies with some form of congenital, deformities and all that. Could that somehow be associated with rubella?
In many instances.
Is there any link?
Yes. In many instances, what has in fact happened is that these women unfortunately contracted rubella during their pregnancy, either before or during, but it's carried into and it affects the development of the baby. Because we weren't really diagnosing this before, we weren't paying too much attention to it, and we also didn't have the vaccine in our routine system yet, so
that's for rubella.
For rubella, yes. The measles vaccine has been on the routine program for many years, But now, because of efficiency, we have a combined vaccine that actually tackles both of them. So, in fact, some of those congenital anomalies, probably not all of them, because there are a few other causes, but some of those congenital anomalies, these are the birth defects that children have at birth, are attributable, in fact, to rubella.
Okay, tell us, why is polio still a concern, in Nigeria, and how does, circulating variant poliovirus type 2 affect the eradication efforts?
So, decades ago, Nigeria had thousands of cases of wild poliovirus. The government, partners, and Nigerians, the traditional leaders and communities came together and through a concerted effort really pushed very hard and ended that epidemic, that local epidemic of wild poliovirus. That we were certified free of wild polio in 2020, and Nigeria remains free of wild poliovirus. Just wanted to establish that fact. Unfortunately, a variant type came up and started to spread, as of 3-4 years ago, again, really just ravaging and going around the country. But now, through concerted efforts of some of the same approaches and tools that we used before, trying to reach every child with the oral polio vaccine. Again, the problem was that we were missing the same children over and over again. So when you have clusters of children that have missed vaccination, for a while, then the virus enters the community and starts to spread there. So aggressively now, through reforms of our polio program, we have tried to identify those locations. We're also doing polio campaigns. Of course, polio is integrated with this measles rubella campaign as well. It's one of the interventions that we're delivering. But even beyond that, in between campaigns, we're going to specific high-risk locations and trying to identify children, try to target them one by one to address the reasons why they're missing it, the reasons why their parents are rejecting, the reasons why their communities have not been reached, and trying to make sure they get these vaccines and prevent disease.
Let me. There's something I'm not getting clear with the integrated vaccine for measles and rubella. You've said that children, parents should take their children 0 to 14 years, for vaccination, which means children will be given the integrated vaccine. But rubella affects the child, during pregnancy. So should mothers also, part,
especially pregnant women.
Pregnant women, should they also take this vaccine? Because I don't understand at what point the child needs to take,
So in fact, pregnant women are encouraged. It's part of the vaccines that you should take when you're pregnant. But you see, because this is a population campaign that is also integrated with many other childhood vaccines. Once you take the vaccine, you are protected until you grow up and you start to have babies. So we want to catch them early, you know. So we're targeting the children population now. But as part of routine care for pregnant women, rubella protection is part of it.
Oh,
Okay,
Yes.
all right.
interesting.
Okay, okay. Tell us, who are the major stakeholders and what role do you envisage for them?
So if you think about the range of children that we're targeting, it's from birth to 14 years old. You have people who are at home nursing or in nursery school. Those are in primary school, in secondary school, children that are out of school, you know, teenagers. So we're being very multi-sectoral. The health sector, you know, we're working with communities, of course, and gatekeepers, traditional leaders, women leaders, religious leaders, churches and mosques to reach our young women and our, you know, older women that can also influence the younger women. Education sector is very important, you know, formal, informal education. We're collaborating very closely with them because school program and school vaccination will be critical to reaching the older kids, you know, amongst this cohort.
Are you taking traditional and religious leaders along too?
Absolutely, absolutely. The First Lady of the country, Senator Oluremi Tinubu, kindly flagged off this campaign on Monday, and you know, His Eminence the Sultan was there in person. The Onirisha of Ife was there. You know, Imperial Majesty was there in person. We had the Emir of Argungu. We had the President of Khan. You know, we had you know, representatives from the religious leaders and the traditional leaders, and that's because they influence the people. They are gatekeepers of information. They inform what people do, so people listen to them. So we need them to put out the word that the vaccines are safe. They are effective, you know, and people should take them to protect their own lives. The government is doing its own part to make it available. The president has resourced it, has made this available to Nigerians, and we have the responsibility to take it to protect our children. Other stakeholders remain, you know, you all in the media space, you know, you are also the gateway of information, and I cannot miss this opportunity to also ask that programs like this, but also just frequent dissemination of information. We're happy to avail you, you know, of information and jingles, and where there are questions, also let us know. Of course, teachers, caregivers, you know, all of those are very important stakeholders.
Fantastic. Let's quickly, let me try to put, you know, multiple questions because of the time. We are running out of time. First, this vaccine, integrated vaccine, is it new? Are there symptoms after taking them that, you know, parents should take note of? And how do you intend to preserve its potency in terms of, you know, cold chain management and all that?
So the measles rubella vaccine in particular is not brand new, it's not new in the market. It's been used in many countries for years, but we're newly introducing it, you know, as a combined vaccine in Nigeria. And the reason again is for efficiency, but also just because it's the same age of children that you target, so for convenience. It's an injection that you give a child. So every injection comes with a few potential side effects. There's pain, potentially, for the child. There may be a bit of swelling and all of that, but there are very simple ways to just balm that and treat it and give the child. There may be slight fever, you know, because again, it's a measles-containing vaccine. You know, people are very familiar with the measles vaccine. That's the advantage that we have here as well. You know, so it's very similar to what we're used to. You may have a little fever, a little irritation by the child, but simple.
Is it because it's combined?
No. Even the measles vaccine alone would give that because, again, it's a life-attenuated virus. So the idea is a weakened version of that can, you know, trigger immune reaction, and children can react in different ways to that. It's a cold chain dependent vaccine, to your point, and one of the things that the government has also done is to even introduce this. We did an assessment and identified where there were gaps, and you might have been aware that about a couple of months ago, you know, we distributed about 1,642 units of solar direct drive refrigerators to health facilities in places where there were gaps. So we have systems in place, very strong systems, to not only store the vaccines at every level, federal, state, and local government, but also to track them in transit. So we have remote temperature monitoring devices so that where we are in our office, you can see, you know, the state of your vaccines, where they are. We're also tracking the stock to make sure that it's one thing to be potent, it's another thing for it to be adequate in the field.
Okay, my last question will be on, you know, your expected outcome with the involvement of the First Lady. I mean, that was a very robust national flag off, performed by the First Lady. So what's your expected outcome now that the First Lady has done the flag off?
I think, again, we're very thankful and for her graciousness, because, that just demonstrates the First Lady's commitment and, to the health of Nigerians, which is in line with the President's agenda for us as well. Now, but she also threw a challenge, which gives us a number of steps. First of all, the cascade of this. Many state First Ladies have also flagged off. Some governors have been involved. And then, all of the stakeholders, all of the facilities, will be providing vaccination. About 19 states plus the FCT, and 19 states of the North plus the FCT and Oyo State, so that's 21, are starting right away in the first phase. The rest of the southern states, excluding Oyo, will do theirs in January or February. Now, this vaccine, everybody is supposed to take 2 doses of it. And the idea is that during these 2 phases of the campaign, the output that we want to reach 106 million individual children. Now, the second dose of it will then be part of the routine vaccination, because then you have a record of these children, you know where they are, and then you can link them to the neighboring health facility for the second dose, which should come, 4 or so weeks after.
Is it free? And where
yes.
can parents go now?
Okay.
It is important to know that the government is providing this vaccine for free, as with every routine and campaign vaccines for all Nigerians. So parents can go to all health facilities, primary health centers, general hospitals, federal teaching tertiary hospitals. Private hospitals, may or may not, if the vaccine is provided for them for free.
Okay, Dr. Mui, before we allow you to go,
yes.
Tell us how these initiatives align with the primary healthcare system.
One of the core pillars of what we're trying to do is to reform our campaign structure. The campaigns are not the normal way of doing things. There should be a routine system where every child routinely comes in and gets the services. So this is part of our health campaign effectiveness.
Dr. Mui, I'm sorry, I have to stop here. Executive Director and Chief Executive Officer of the National Primary Healthcare Development Agency, we wish you all the best, and we'll certainly will be following you up, and we will come and get those jingles and adverts that you talked about.
Thank you.
Thank you very much, sir, for joining us. All right, that's Good Morning Nigeria for this Wednesday. I thank you for joining us. I am Claire Adilabu Abdulrazak. Bye-bye. I'll see you next week.
All right. Do have a lovely day.